Hey everybody, Dr. Shook here. Today we're going to talk about one of the most important things that I can teach you about Hashimoto's disease. Now, Hashimoto's disease is an autoimmune disease of the thyroid, but a lot of people don't realize that this is a multiple system autoimmune disease, and it affects many different aspects of your health, including brain health, and it can lead to neurodegeneration and a lot of problems with your brain over the long term. Now, some people develop really severe forms of neuroautoimmune diseases, and this can create massive issues. And I have worked with so many people that have problems that are not identified medically, and quite frankly that they have been, quote, everywhere. And this neurological autoimmune process is missed because the medical physicians that they're working with are just not familiar with this part of the pathophysiology or how this occurs. So let's get into this. Let me walk you through exactly what's happening so that you can understand and get a better idea if these things are happening to you. And then also, I'll give you information on testing that might be helpful, as well as things that you might want to consider doing to help yourself. Okay, so let's get right into it. So the first thing to understand here, if you draw your eyes to this clinical severity of Hashimoto's in the brain, this chart. Okay, this is really helpful from a perspective of just getting an idea of the spectrum here of how the Hashimoto's disease process can affect and really destroy neurological tissues. Now, on the left-hand side here, we have normal. There's no, in this case, this is the ideal situation where there's no inflammation or neurological autoimmunity against the brain. And on the far right-hand side, the most severe situation is something called Hashimoto's encephalopathy, and it's inflammation and damage to the brain from Hashimoto's. Now, this happens in less than 1% of people with Hashimoto's, but it does occur. This is typically associated with delirium and very serious neurological consequences. It is something, there are different forms of it, but in most cases, it is steroid responsive encephalopathy, meaning when they give steroids that it tends to improve their symptoms. And that's really how it's differentiated and diagnosed when someone presents with that type of pattern. So it's the most severe form. And I have worked with people that have had bouts of Hashimoto's encephalopathy, and it is an extremely scary thing for them, and it's a serious condition. Now, in between, and the further to the left, you're going to see that the first thing that we tend to see, the most common symptoms that we see in people with Hashimoto's, is mild cognitive impairment and neuroinflammation. Now, this often presents as memory issues. Actually, the most common symptom is just fatigue in general. They just have no energy. Now, a lot of people think this is low thyroid hormone, and that is something that can contribute to it. But by far, the most common thing that we see is that fatigue in people with Hashimoto's, once they are on thyroid hormone replacement, is actually being driven by this neuroinflammatory component. And this is something that once you dampen and improve, you tend to see energy levels improve significantly. So you'll see just general fatigue, but you also see diminished cognitive endurance. So they just cannot continue to focus on anything without becoming very significantly fatigued. Then you'll also see issues with memory and learning. You'll see a lot of these types of issues with attention. These are all things that are very common at this stage. And this is absolutely part of Hashimoto's. This is not something that is, it's not a different problem. So if you have a low thyroid, hypothyroidism, you have a 9 in 10 chance of that hypothyroidism being caused by Hashimoto's, this autoimmune process. Most people that have a low thyroid have no idea it's being driven by autoimmunity. None at all. And that is a huge issue because there's so many things that you could be doing and that you should be doing to help yourself. Now, as we go further into more severe reactions that are associated with Hashimoto's, you get into early cerebellar degeneration. This is the back part of the brain. I've seen several cases of this where people present for care. I work with people via telemedicine all around the world, and they'll submit all of their medical records, their lab testing, and we'll go through and do a detailed history and dig really deep to try to understand what's happening here. And you'll see issues with anxiety in crowded places, which is absolutely a sign that the back part of the brain, the cerebellum, is unable to integrate your surroundings and to basically give your body or your brain information on whether or not it's the environment that's moving, or is your body moving? And so the brain has a problem dampening all of this external information and movement, like especially if you're like in a crowded place, and it activates your sympathetic nervous system, which is your fight or flight response, and that will absolutely drive up your heart rate, make you feel anxious, and it's anxiety induced by crowded places. That's part of the pathophysiology, and that is a sign that the cerebellum is degenerating. Now, the other things that you'll see symptomatically is you'll see like people have problems with balance. Like they'll say, I just walk around my house and I run into the doorway all the time. Well, that is absolutely also a potential sign of cerebellar degeneration and your issues with balance that you may not be aware of. You'll see issues anytime the cerebellum's degenerating. There are also problems with it. The cerebellum is like a processing center for so many things. So there are physical things that you'll see occur where like if you try to do the sobriety testing that most police officers might administer if they're trying to determine if someone has been drinking or if they're under the influence, they'll have them walk like heel to toe. People should be able to do that without falling or losing their balance. You'll see that people with Hashimoto's oftentimes can't do that. That is a positive that is a positive test and a negative sign that you have cerebellar involvement. Standing with your feet together, eyes open, and just standing there, see if you can maintain your balance. Then, have someone stand beside of you in case you fall, and close your eyes and see if you start losing your balance. If you start losing your balance, that's called a positive Romberg's test. That's a sign that your cerebellum's involved. This is a very serious issue because there are many things that you can do to dampen this, to dampen the autoimmune process. I'm going to talk about that in a second, but that is those are major issues. Now, also the cerebellum's involved with speech processing and with other initiation of movement, eye movement. So you'll see double vision occur. I mean, I've seen this occur a lot more than you'd think. And a lot of people have these signs and symptoms and they think, oh, it's just my eyes getting bad because I'm getting old. It's just, it's totally unaware it's related to the autoimmune process. And there's so much that can be done. And then as we go further, you get into demyelinating neurological autoimmune diseases. Now, this is true autoimmunity against the brain. And this is where, if people have a budget to do this, I always recommend when we have Hashimoto's doing expanded autoimmune testing to see where else is the autoimmunity. Because oftentimes when you have one autoimmune disease, you have over a 50% chance of having a second one. And I think it's much higher than that actually if you do really expanded testing and look at a lot of tissue markers, tissue antibodies, basically, to see if the autoimmune process is expanding other places. We most commonly see with Hashimoto's expansion to the brain. We see neurological autoimmunity. We see antibodies against the nerve cells. We see them against different components of the nerve cells, the synapse. We see it against the structural proteins in the brain. We see it very commonly. So this is something that I try to recommend for people so you can get an idea of what is happening. Because if you have autoimmunity against your brain, you are losing nerve cells and neurons that you cannot get back. You cannot get them back. You may be able to improve plasticity and make new connections, and there is some evidence that you might be able to create new neurons, but that is something that is very slow, if at all. So you want to preserve it as much as you can. So, okay, without further ado, let's get into Hashimoto's and these neurological consequences. I'm going to walk you through the most common aspects of how this Hashimoto's autoimmune process and hypothyroidism, the low thyroid too, how they impact the brain. Okay, so let's get right into it here. So the first thing that will typically be determined if you have Hashimoto's is that you have thyroid antibodies. Now, you go in, you're fatigued, the doctor will draw your TSH because if they suspect it's your thyroid, they're going to look at your thyroid stimulating hormone and see if it's high. If it's high, then they're going to say, okay, you have hypothyroidism. Now, I wish every single primary care physician would order thyroid antibodies because it would tell you if you have an autoimmune process, but it is not commonly ordered. It's most people that have a low thyroid have no idea they're autoimmune because this test isn't ordered. And this test is one of the very best ways to tell you whether or not you have thyroid autoimmunity. It can be negative in some cases, and you still have autoimmunity. So a thyroid ultrasound is also good, but the thyroid antibodies is a cheap test. You can if you go to my website, I'm going to share it with you later in the video, but it's Dr. Bradshook, DrBradShook.com //resources. I have a link where you can order your own expanded thyroid panel for something like, it's like $70, and it covers all the markers that you're going to need. Thyroid antibody markers, your TSH, your T4, your T3, your free T4, your free T3, reverse T3, and T3 uptake. A ton of different markers, very cheap, very inexpensive. It's not covered by insurance, but it is extremely cheap. You can order that, and you can get that done like near you with a blood draw very easily. So I try to make that available to everyone because many people cannot get access to the care they need. Okay, so you're going to learn a lot here. So just pause, come back if you need to. But thyroid antibodies. Now, these thyroid antibodies, see, this is what the primary care physicians and a lot of the doctors are unaware of. And this is all in the scientific literature. Everything I'm sharing with you here, there's evidence basis for it. So the thyroid antibodies are one of the major issues. We'll get into how those impact the brain. The other things that Hashimoto's and autoimmune reactivity do is that when you have the autoimmune process, you will increase these proteins made by the immune system called cytokines. Cytokines are protein messengers made by the immune system that crosstalk with other systems of the body, okay? With your endocrine system, with your nervous system, they crosstalk. So they have an influence on those other systems. And the cytokine activation, the cytokines can cross the brain and drive neuroinflammation. We'll talk about that. Another thing that Hashimoto's does is that it will create the inflammatory process, will actually impair the thyroid hormone activity in the body. So even if you have normal hormone levels, it's not going to stimulate the cells the same way because you have decreased a cellular receptor response. So your hormones, your thyroid hormone, all your hormones, they go to your cells and they bind to a receptor. It's like a little docking station. That allows the hormone to influence the cell's physiology and change how it works, allow it to produce energy, allow it to carry out. It's a signal, right, to the cell. And what happens is the inflammation decreases the cell's ability to respond to the hormone. So this has a cascade of negative effects on throughout the body, but also we're talking here specifically about the brain. So let's get into this a little bit more. Now, the thyroid peroxidase antibodies that we mentioned was the best test to help you understand if the immune system is reacting abnormally to the thyroid. What they've shown in scientific literature and research is that these same exact antibodies, the TPO antibodies, when they mix them with cerebellar tissue, when they mix it, they find that these TPO antibodies strongly attach to cerebellar, in particular, a type of cell called the astrocyte, cerebellar astrocytes. What this means is that these antibodies made against the thyroid, if they're able to cross into the brain, which happens very easily in a lot of cases, especially autoimmune cases, because your blood-brain barrier, a barrier system breaks down, it allows these antibodies into the brain, and then they can then bind to these cerebellar astrocytes and trigger an inflammatory autoimmune response against the brain. And these are the same antibodies. This is called cross-reactivity in immunology, the study of the immune system. And this is the reason that this occurs is because the cerebellar tissue is very similar in shape and structure on a protein-based level, on a molecular level to the thyroid TPO and enzyme in the thyroid. So this antibody can bind to them both. It can't tell them apart. So that's called cross-reactivity due to the similarity in how they look, which is called molecular mimicry. Okay. So what this does is this leads to a lot of problems. It leads to cerebellar tissue cross-reactivity here. If you follow me at the top of the screen. So it binds to the tissues of the brain, causes this inflammatory response, and it leads to cerebellum destruction and brain degeneration. And this puts you on the spectrum again here on our clinical severity of Hashimoto's in the brain, where you're more likely to start progressing towards early cerebellar degeneration here in the middle. Okay, so I hope this makes sense. Now, the next thing that you're going to see is, and this is something that is very important because of the connection here, you may have heard that people that have Hashimoto's should avoid gluten. And I would say food proteins are a very common driver of the autoimmune process. There are, and I'm going to talk about that model very briefly in a minute, but one of the things that's very common that we see is that people that have Hashimoto's often have gluten sensitivities too. Now, there's a difference in a gluten sensitivity. There's a difference in a gluten allergy, which is a different type of immune response. And you can test for these. You can actually do a blood test. You can look for the different types of antibodies, and you can see what's happening from an immune perspective. Quantitative data, repeatable testing, you can see it on a lab test. So anyone that tells you that gluten sensitivity is not real, they don't understand the current state of the literature, because it's there and it is a real thing. Now, the thing too about gluten is that they've showed that people that have, you may have heard this with true gluten allergies, that there's a condition called celiac disease. Most people have heard of this. It's where you have a true allergy to gluten that causes an immune response against the small intestine and just destroys the lining of the small intestine, because the immune system is reacting to an enzyme in the small intestine called transglutaminase 2. Okay. There are other transglutaminases throughout the body. There's transglutaminase 3 in the skin, and you can actually have an immune reaction. Some people with celiac disease or with true gluten reactions will have something called dermatitis herpetiformis, which is a true autoimmune skin disease. And then there's transglutaminase 6. Transglutaminase 6 is found in the brain, and it is strongly concentrated in the cerebellum. So people that have gluten sensitivities and gluten allergies like celiac, they also have a true autoimmune response against tissue transglutaminase 6 in the brain. It's like a celiac of the brain, and a celiac disease of the brain, and they have neurodegenerative diseases of the brain. There are published case studies on PubMed showing these neurodegenerative processes occurring because of this tissue transglutaminase autoimmune response. So we often order a test, which I'll talk about in a second. It's Cyrex Labs Array 3X that actually tests for this and shows if you have antibodies against tissue transglutaminase 6, and it checks every way you're going to react to gluten, just about. It's the best test out there for this. And I found this in several people. So this is super important, because this is one more pathway in addition to those thyroid peroxidase antibodies binding to the cerebellum. This is another pathway where this gluten autoimmune response can be driving the cerebellar degeneration, and we often see both of these things happening in people with Hashimoto's. Super, super important. Very commonly missed. Okay, so very important. Now you know, like cerebellar degeneration, that can be driven by the Hashimoto's process right in the middle, right? It's not that uncommon. Early cerebellum degeneration, can be driven by the Hashimoto's process because of TPO antibodies reacting, because it can attach to the brain. It looks the same as the thyroid enzyme. And due to gluten autoimmune responses, right? Tissue transglutaminase 6. Now then, these are the tests I have pulled up on the screen here. Cyrex Labs testing Array 3X, Array 5, Array 7X. Now, again, for free resources, and if you need help, I do offer telemedicine across the country, around the world. We can order these tests for you, and just go to Dr. DRBRAD. It's on the screen, bradshook.com/resources. I have giveaway free the dietary strategies I commonly use, the lifestyle strategies I commonly recommend, the supplementation I commonly recommend. But if you have these problems occurring, you need to work with someone one-on-one to help you determine your unique triggers, because everyone has different triggers. It's not something that you can just willy-nilly guess at and typically hit home runs and improve everything. You can do it. I would recommend doing something rather than nothing, but if you can, work with someone that understands functional immunology, which is what we're talking about. Now, another thing that happens here is that Hashimoto's will often drive this cytokine or inflammatory response. And this is super important, because these cytokines that we talked about earlier, they can cross the blood-brain barrier. Even if the blood-brain barrier is not compromised, these cytokines can cross into the brain, and they will trigger an inflammatory response, because they'll activate the microglia, the immune cells of the brain. Now, this can lead to neuroinflammation, neurodegeneration of the brain, because nerve cells do not like and do not function well with increased inflammatory chemistry. You don't want to activate the inflammatory response in the brain. If you do, you want it to be for a reason, and then you want it to calm down. You want it to resolve. You do not want prolonged inflammation. It will create massive problems, which we're going to get into a bit. The other thing is that activation, so it activates the microglia, which I got ahead of myself here, but brain immune cell activation, and it also will break down and cause blood-brain barrier permeability. Now, this is a major problem, because it will cause progression along this Hashimoto's spectrum here of neuroinflammation and degeneration. Now, another thing that these cytokines do, so you can see here we're going on with our diagram. Another thing that these cytokines do, when they activate the brain's inflammatory response, you get altered synaptic activity, which is where the nerve cells join, basically, and you get inefficient nerve signaling, basically. So your brain is not working normally. You get decreased nerve growth factors. So there's a nerve growth factor that a lot of people may have heard of called BDNF, brain-derived neurotrophic growth factor, and this is like food for the neurons. It helps them to be healthy and to make new connections, and it means that and it decreases it here when you have this inflammation, so they don't grow as well. You also have impaired synaptic pruning. So just like a plant that grows and it gets a lot of branches and it overgrows, you have to prune it back some so that it grows back better, more efficiently. It's as it should be. It's healthier too. Well, your brain, you have immune cells that do this too. They help to prune the neurons and keep them more healthy, and you get impaired pruning. So you have unhealthy nerves that are not basically managed or maintained well. And this all leads to decreased plasticity, meaning the neurons can't make new connections, which is critical for learning and for the health of our brain. And so they don't grow well. And this is a major issue. Think about it. These things would all affect the health of the brain, and it's going to push you further on this spectrum into mild cognitive impairment, neuroinflammation, and down this pathway you do not want to go. And this is all part of the Hashimoto's pathophysiology. That's what I just try to repeat it over and over. This is part of the pathophysiology. This is not something that might happen. If someone has Hashimoto's, you should assume that they have some low-grade neuroinflammation, period. Period. Nothing else to say about it. Period. And then you should be looking for this. You should be doing cerebellar testing. You should be doing at least the Romberg's test. You should do the tandem gait with heel to toe. You should do the cerebellar test, neurological examination testing to see what's happening. Those are things that should be done. So the next thing is at the bottom of our diagram here, expanding. We got to go quick here because I don't have much more time. But Hashimoto's autoimmune reaction, this also leads to impaired thyroid hormone activity, because remember I said increased inflammation decreases the cell's ability to respond to the hormone that's in circulation. So you could have normal hormone levels and be like, it's not my thyroid. You're right. It's the autoimmune process decreasing your cell sensitivity to the hormone, so you don't have a normal, healthy response, and you still feel like your thyroid's not working. Your thyroid hormone's not working. It's because it's not. It's not working as well because there's an underlying process that has not been addressed. Okay, so what this does when you have this diminished response to the thyroid hormone, it will decrease your synaptic activity. Now, the synapse of the nerve is where the nerve cells meet. It's the junction, and what they do is they signal from one nerve cell to the next by releasing neurochemicals or neurotransmitters. Now, when you have this decreased nerve signaling, it lowers your neurotransmitters. Your neurotransmitters aren't produced as well. And this means that you'll have decreased dopamine, which is responsible for motivation. You have decreased serotonin, which is responsible for mood. Decreased acetylcholine, which is responsible for learning and memory. You have decreased GABA, which helps you with being relaxed and calm. So you have more anxiety. You have problems sleeping, a brain that won't shut off. You just perseverate on things and just constantly think. These are all things that can happen because of just this impaired thyroid hormone activity due to basically this inflammatory response. So that will push you further along an unhealthy brain. Now, another thing that occurs, we're at the bottom of the diagram now, is that this will also contribute to impaired axon branching. So there's different parts of nerve cells, and there's an area called the axon. And the axon basically has you have branches that are think of a tree or a plant, and these branches can grow out and join to neurons, make new connections. And what happens here is if this process is occurring, you can have impaired branching. So your nerve cells cannot even branch to one another and signal one another efficiently. So you have, again, this leads to neurodegenerative processes and impaired plasticity, which is the ability of the brain to make new connections. And so decreased nerve regeneration and decreased connectivity. These are obviously, I think you can tell these are major issues, and they will push you further along that spectrum. Now, something that a lot of people have no idea about, and this is really, really important. If you've ever seen someone with severe hypothyroidism that's been happening for a long period of time, they'll tend to have fat deposits in places that you were like, why do they have puffy fingers, and why are their arms swollen, and why do they have it looks like fat on their shins and on their legs? Like, why are they so fat and puffy everywhere, right? Not to be crude, not to be hurtful or anything, but it's a genuine question. And this is part of the pathophysiology, especially people that have prolonged hypothyroidism. Now, so what this does is it creates tissue swelling. Now, technically, this is called myxedema. Okay. Now, so this process causes tissue swelling. That's what you're really seeing there is tissue swelling. And this leads to two different problems for your nerves and then also for your vessels. This can lead to peripheral nerve entrapments. So nerves outside of basically the brain and the spinal cord, all the nerves that once they leave the spine, they're peripheral nerves. They're out in the body. Okay. So inside the brain and the spinal cord are central nerves, central nervous system. Outside of that, they're peripheral nerves. And so those peripheral nerves, as these tissues swell, they can actually cause internal compression on the nerves and cause neuropathies. Compressed nerves, that's a peripheral nerve entrapment. So this is a good example of how swelling can do that is in pregnancy. Women can develop like carpal tunnel syndrome, and that's due to swelling. That's not due to them having carpal tunnel from, repetitive use of their hands and wrist. That's due to swelling. So that can happen with Hashimoto's. And this happens to a lot of people, and they're totally unaware that that's what's causing their neuropathy and their nerve entrapments. And they're going down all this path of, having release surgeries and everything else. And that might be appropriate, but also what's causing it. Okay. So this tissue swelling can also cause neurovascular entrapments. Now, you can get something called thoracic outlet syndrome. And this is compressed vessels, blood vessels, and nerves. So in your neck, you have these bundle of nerves and vessels that branch off the heart and then also leave the spine and they go into the arms. And you have a little window, a little triangular window where they pass through. Because of this swelling, you can actually cause compression of those vessels and those nerves, and it can cause thoracic outlet syndrome. Major issue. Now, this all leads to the peripheral nerve damage, leads to peripheral neuropathies, and then this neurovascular entrapments like at the thoracic outlet leads to thoracic outlet syndrome and compressed vessels and nerves in the upper extremities. Okay, major issues. Now, I hope you understand this is part of the pathophysiology of Hashimoto's. Now, the way that I approach this clinically and the way that this should be approached is called the environmentally, this is my opinion, but the way that you address drivers and triggers is based on an immunological model of autoimmunity. It's called the environmentally induced model of autoimmunity. And there's a triad. There's three things here. I do full video series on these things, so I can't go over it in detail here except to say this. The diagrams on the screen here, you have to address the immune barrier systems and get them healthy. The environmental triggers, which tend to be food proteins, pathogens, chronic infections, and chemical immune reactions. You have to address immune dysfunction, deficiencies, chemical exposures, stress. There's many things that can drive that immune dysfunction. You take the person's unique triggers and drivers in these, you put together a tailored plan for them, and then you work through it and you see how they respond, and then you revise. You use testing to help guide you if there's a budget for that. If there's no testing, there are trial and error things that you can do and see what you can do to help. And that, so there's not all is lost. If you have no money, there are definitely things that you can do, starting with food, that can be really powerful. And that's all free if you go to on the screen here, if you just go to my website, drbradshuk.com/resources, there are some links and you can have total free access to the dietary strategy I use, the lifestyle recommendations. And that's when I say strategies, those are typically for people that don't have access to testing. But we'll sometimes use those things and tailor them based on test results too, or based on consulting with me and my experience and guidance based on what I see happening and what is, I can help tailor the protocol based on what is more likely driving the problem. So anyway, if you have questions, ask them in the comments. I'll help you as much as I can. I have free resources on my website. I try to make testing publicly available so people can go get testing themselves, even without me, and get information. So I appreciate y'all spending time with me. I hope this has been helpful. Hope you have a wonderful day. Talk to you again soon. Thanks.